I'm Dr. Lowe. I'm a family medicine doctor. I train at the University of Minnesota and at a residency program in Mayo Clinic. For the past 20 years, I've been a family medicine doctor, taking care of patients from many different cultures. I speak English and my native language Hmong fluently.
And whenever you are in a cross-cultural medicine space, I think it is very important for physicians and providers to create a space where your patient and their families would feel comfortable to express their concerns, ask questions, and advocate for themselves. So let me present the case. As I said, this is a 60-plus-year-old Hmong man. He asked me some questions about a condition that he has. So he told me that he had been diagnosed with brain cancer, yes, that he had two separate lesions in his brain. I was a resident, and he came to the emergency room while I was on call and admitting patient for our service. And he came to the emergency room with a seizure. And we determined that his seizure was due to the edema in his brain that was increasing because of the increasing size of the brain lesions. And we laid out the plan for him of what we would recommend. And that was to do a brain surgery, which would involve a craniotomy and then getting a biopsy to determine whether or not this is cancer and what type of cancer. And by the third time, it became more clear to the family that something had to be done. We had a family conference, and we answered a lot of questions. And one of the things that came out from the discussion with the family was that they didn't know what would happen to the screws that we would put to close the skull once we completed the craniotomy. And that question raises the cultural belief that in certain Hmong family, particularly very traditional Hmong family, the belief that when and if a person dies, they don't want any artificial object in the deceased body. So in order to help this patient navigate this cultural barrier, the plan we recommended to the patient was that the patient should complete an advance directive. And in that advance directive, we documented that when and should the patient dies from this condition, that his physicians, myself, and our neurosurgeon would take out the screws. One day we heard from the family that he had passed, and that they asked for us to go to the funeral home to remove the screws from his skull. And so I called up our neurosurgeon, and we both went to the funeral home and removed the screws that were in his skull. Now, the analysis of this case is looking at cultural barriers that we as provider, as physicians, can help patient navigate.